Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. My name is Primanda, and today I would like to present my paper with the title Improving Knowledge of Non-Communicable Disease Prevention Among Junior High School Teachers to Achieve Golden Indonesia 2045. These are the information about the theme and also the program title of this program. First, I'd like to start with the background of the study. The number of non-communicable diseases among adolescents is increasing rapidly both globally and nationally. Today's youth are the generation of the next 20 years when Indonesia reaches 100 years old golden Indonesia, who are expected to be able to bring Indonesia to a better conditions. If adolescents are currently experiencing health problems such as non-communicable disease that have various long-term complications, then preventing non-communicable disease in adolescents is essential and urgent to do. The level of knowledge and attitude of teachers related to health promotion is significantly related to the implementation of health promotion efforts, such as obesity prevention, where the teachers with a good level of knowledge and attitude towards health promotion will also improve health promotion efforts to prevent non-communicable disease. However, efforts to prevent non-communicable disease in school still do not seem to be optimal and are focused on adults. The objective of this research was to improve the knowledge of teachers regarding non-communicable diseases prevention and to do the screening of the student to achieve the success of Golden Indonesia in 2045. The target and scope of the research was teachers and students at Serandakan Junior High School Bantul, Yogyakarta, Indonesia, a state school in rural areas. For the methodology, we used quasi-experiment with one group pre-post-test design with a sample of 92 students and 29 teachers. The intervention consists of students' intervention and also teachers' intervention. The data was collected using valid and reliable instrument, and we did the pre and post test of knowledge test before and after the intervention. The data was analyzed using Jamovi, and for the statistical test, we used descriptive and Wilcoxon sign rank test with the p-value less than 0.05. These are the results and discussion. For the demographic and clinical characteristics, we found that some students were overweight and obese. Based on the blood pressure measurement, some students were categorized into pre-hypertension, and we also found students with the hypertension. And for the random blood glucose measurement, we found students with pre-diabetes state. Based on the results of knowledge before and after the intervention, we found a significant improvement of teachers' knowledge before and after the intervention. Based on the 2023 American Diabetes Association screening criteria, at least 35 of the students in the study had 3 or more risk factors for type 2 DM, placing them in the high-risk category. The most prevalent risk factors consist of obesity, family history of DM, inadequate physical activity, hypertension, and symptoms of hyperglycemia. The combination of these factors creates ideal condition for the development of early type 2 DM as predicted in the pathophysiological model. These findings are consistent with previous research that reported an improvement in teachers' knowledge after a health education intervention, albeit with different variations in effects depending on the training method used. In conclusion, this study succeeded in mapping the risk profile of type 2 DM in junior high school adolescents in rural areas in Indonesia, and we found that teacher training has shown effectiveness in increasing knowledge about non-communicable disease prevention, and this finding supports the need for comprehensive and sustainable approach to the prevention of type 2 DM in adolescent population, particularly through school-based intervention integrated with public health system. These are some documents related to the program implementation. Thank you very much for your attention. Assalamualaikum warahmatullahi wabarakatuh.